We ultimately have been working very hard, both with ServiceNow and internally here at CDW, to see what we can do to help our clients and organizations through these challenging times. And you're going to see a bit of that today. And thanks to Greg Weiland and Matt Benson, who are part of the CDW team that suggested this webinar. So we put this together, teed it up, and look forward to sharing this with you. We're going to do a number of things, and I'll share the agenda with you here. I'm going to introduce our two speakers, both from the CDW ServiceNow team. Steve Horvath is the Chief Architect, and Eros Canabrava, who heads up our R&D group. We're going to give you an overview. Steve's going to lead us through what this platform's all about, the different ways we're helping clients, and you'll get a good feel for it at a high level. And then we're going to have Eros actually take us for a live tour of the portal and some of the things that you can do with it. And we'll finish up with a Q&A. So throughout the session, if you have questions, there's a Q&A section on a panel on the right side, and you can submit questions there. We'll be monitoring those questions, so at the very end, I'll come back on, and with whatever time we have left, we'll answer some of those questions. And if we don't get to them, we'll make sure we follow up with you personally on that. So on that note, I'd like to turn it over to Steve Horvath. Steve.
Thanks, John. Thanks, everybody, for being here. Again, this is going to be a quick view into what we've been able to put together for crisis response. Obviously, with the COVID-19 situation that we're all facing, that was kind of a catalyst for creating some of this, but I do want to emphasize that crisis response is something that extends beyond just COVID-19. It's really something that we built as a frame to help with that. Of course, it will help in the midst of our current situation as well. So John, to your point in the agenda, we're going to go through and do a quick overview, and then Eros is going to jump on and do a little bit of a tour with us. And again, we will have time for Q&A at the end. One of the things that we really want to focus on as we build something like this out is really understanding risk that's posed to us with our organizations as we do that. And I think as we look at risk, you know, there's a few things that we're really focused on. One of the things is really just confusion and avoiding a breakdown in communication. When we move into crisis mode, it's really important more than ever that we have that good communication structure, as well as making sure that we're not fragmenting responsiveness. One of the things that can create a lot of confusion is when we have different sources of responsiveness, it's not centralized, and that fragmentation can introduce a bit more chaos. Additionally, you know, as we know, we're in this work at home state, we're all in this state where there's some isolation going on. I think for many of us, we're used to working closely together. Some people are more acclimated to work more in an at-home environment than others. But the one thing we really want to focus on too is that in the midst of crisis, that we're not introducing a sense of isolation in the midst of that. People want to feel connected, especially to our organizations, and make sure that we've got a good sense of community. We also want to make sure that there's a way to stay in touch with our employees, with our customers, with our partners, to make sure that there's a way to field information, to manage things that come up as we deal with that, and answer questions, and even manage work associated with that. Additionally, one of the risks that we face is, we talked about the fragmentation, but disconnected tools, having things in different environments, having to shift between different applications to be able to provide that level of centralization and communication can sometimes increase that stress. And it also creates a level of inefficiency for our teams. So these are things that we really want to focus on in times of crisis. And that's one of the reasons that we built this crisis response portal, is to bring these risks together and really focus on ways to help organizations very succinctly and very purposefully manage as efficiently as possible through these types of crisis situations. So as we go through and we look at this and we introduce each of these risks, right, we're going to use as a framework the ServiceNow Customer Service Management application suite as a way to bring this home and demonstrate some of what we've been able to do. We did use that as a basis for building out this centralized portal type of environment. As we focus on the risk of communication breakdown, some of the things that we want to point out is really this ability to centralize communication in one space, have our constituent groups, our partners, our employees, our customers go to one area and get the same consistent messaging. So broadcast messaging for urgency, having the ability to centralize knowledge, build common knowledge bases, and even update those knowledge bases so they're relevant, they're timely, they're purposeful, they're in a same environment. And even on the portal, having this ability to have timely messaging, frequently asked questions, maybe frequently asked or frequent articles from a knowledge standpoint, we're going to talk a bit. So as we look at knowledge, being able to have taxonomy around that. One of the things that we did as part of this crisis response portal was build a specific knowledge base where we compiled information from reliable sources, World Health Organization, CDC. We've compiled a pretty substantial knowledge base with articles. And as we look at that, what we're able to do is have commonly asked questions, have common information, things that people would be wanting to understand, all centralized in one spot. So it's instead of fragmented over the web and having people go to Google and search, it's all right here in the portal. And of course, with knowledge management and the knowledge bases, it's very malleable. You can manage this on your own. You can add to it. You can adjust knowledge bases for your situation. Again, centralizing what we're doing, centralizing the communication. It's really about making sure we have that single source of truth for information. The purpose is to reduce the communication, or I'm sorry, reduce the confusion so we have good communication and make it easy for people to find that important information quickly. One of the things with the portal is we've been able to design it in a way using the widget basis so we can pull in, things like different types of feeds, reporting, dashboards. We have built into this crisis response portal the ability to link in the Johns Hopkins data so we can do localized geographic views. We also have the capability to link in other types of social feeds. From a community standpoint, we want to make sure that our constituent groups, our employees, our customers, our partners, they're feeling connected, that we have this, again, this knowledge basis, but the ability to interact. And I recognize certain situations probably lend themselves more to community than others, but within that, this portal gives us the capability to allow communities to interact and engage. It provides organizations with the ability for this kind of connectedness that goes in beyond just static knowledge. So the ability to ask questions, interact with leadership, interact with each other, and really focus on those areas where people are maybe feeling isolated, giving them a sense of connectivity and unity. We also, in the communities, have forums that can be set up, reducing kind of some of the challenges there, but also allowing good moderation capabilities, whether that's community moderation or even purposeful moderation with people that are designated in that. As we look at the communities, forums can be specifically set up, pre-configured around topic areas. We can post rich text like images, embedded videos. And one of the things is centralizing dialogue on topics that are relevant. I know situations that I'm facing in this environment, and I'm talking to customers that are facing topics like, hey, I've got my kids at home. What's the best way to manage that? What are some best practices around that? Even the education side of it, right? From a schooling standpoint, I think as parents we're faced with challenges, and maybe an example of this is having a community for your employees, even with your customers, or if you've got extended communities, to give people the capability to interact around topics like that. So you can build a taxonomy and have those forums set up purposefully. We also want to focus on the ability to centralize and track concerns, right? The questions people would have, if there's work associated with that, the ability for people to log in, to have a connection with our organization, but also submit case information where we can track that. And we can track related work, we can track related responses, we have views into that. So as we look at that, we have the whole case capability that allows us to manage that, manage work, manage the questions, respond accurately, making sure that we're not having things fall between the cracks. We can use templates to build this out, and important case information is tracked. We can use attachments. We can focus on timeline of events. You see some of that here. And we also have the capability for omnichannel support. So centralizing cases that come in, whether it's through the portal, whether it's through phone calls, from chat, from email, even from integrated social media feeds that we may use. Again, connectedness, the ability to connect applications, centralized dashboards, the important data, it's all important in the way that we reduce stress and create these efficiencies. We do have the capability to incorporate the ServiceNow applications that were released, the free applications that were set up, the emergency outreach application, which is designed to distribute information and really confirm safety and location information. The emergency self-reporting application, which is designed to enable people to report their health, self-report, using the workflows to help managers respond. Emergency exposure management, it identifies and manages exposure risk when an employee is diagnosed with an illness in this case. And emergency response operations, really a focus on optimizing staff and resources for emergency response. So this is an example of the portal and extending it out. We can build these apps, we can incorporate these apps, and we can use them effectively. As we look at these portals and knowledge, one of the things that we really want to do is deflect call volume. Sometimes it's referred to as shift left. Gartner refers to it that way, kind of a tier 0 capability. One of the things we can do is build out these virtual agents. And it really provides this agent-like experience that reduces the burden on our service teams. So the agent can pull in human support when needed, but as an example, let's just look at that, and it comes up. I'll just let that flow through a little bit here. The power of this virtual agent is that it uses natural language recognition. It allows us to automatically answer questions. We can incorporate knowledge. We can incorporate the knowledge articles that are pre-built. We can build experiences specifically for your organization. In this case, we pre-built an experience around COVID-19 and commonly referenced situations there. And again, we're looking at, with this portal, to be able to configure that purposefully for our customers and each organizational needs. Again, our main focus here is helping our customers, providing some benefit in this crisis time. Crisis response is really designed around this pre-built portal concept for different types of organizations. So we can quickly implement. We've got a healthcare skin. We've also got skins for municipalities, for school districts, as well as higher education, and for the commercial space. And so we're really poised to move quickly on that. Eros, I am going to turn it over to you momentarily here and let you do a run through.
Thank you, Steve. Okay, let me go ahead and share my web browser. Steve, can you confirm that you can see my screen, please?
I can see it.
Excellent. So I'm just going to do a very kind of high level and highlight some of the functionality that we have here in a little bit greater detail than what you saw in Steve's presentation. So here's just another example around some of the look and feel type things that we could very quickly do due to the flexibility of the platform of ServiceNow. So in this particular case, we've skinned the portal for the University of Chicago's medical department, their hospital there. And we've done a couple of things here that I want to point out. So one, we've incorporated ServiceNow's emergency report check-in application, and we're able to make changes to this based on the particular needs of your organization. So for example, if you wanted someone to check in and maybe tell you who their primary physician was or who their primary physician at your hospital was, we have those types of capabilities. But I can incorporate this right in to the portal and very quickly allow people to report their symptoms. Here, we've also integrated some social media aspects. So I'm pulling in a CDC feed, for example. Now, Steve mentioned earlier that we've pre-populated the knowledge base, and we've created a method for keeping this knowledge base up to date with all of the published articles from the CDC and the World Health Organization. So here you can see that we have a number of articles out there answering common questions from known reliable sources. And many of these have images or even embedded videos. If we go back here to the beginning of the portal, again, this ability to do announcements. So here, for example, we have an announcement around the governor's disaster proclamation. As Steve showed you earlier, we could show this as a banner at the top of the screen. These announcements are things that you could very easily create and push out, or maybe you want to source them from a feed, such as a particular piece of social media or RSS feed or even another website. All those capabilities are possible within the system. And if we look at the community itself, we're able to structure this community in a way where it's very easy to quickly ask questions and get answers. We can create forums and subforums. We can assign moderators here so that you can moderate what's going on within your forums. And that could be anything from whenever someone asks or answers a question, you want a moderator to review before even allowing it to post, or you might want to just do moderation after the fact. You'll see over here that we have a leaderboard. We can introduce some gamification here as well, whereas people that are correctly answering questions, getting upvotes within the forums, they're gaining points within the system, and then we can give them kind of titles, or they can earn different digital prizes that they can display as part of their forum profile. We can either pull in customers or employees or people that you already have within your system through an import process, or we can allow for self-registration within the forums. One of the things that we're very proud of is our virtual agent. So here, as Steve mentioned, we've created a number of different virtual agent experiences. And one of the great things about the agent is that really you get the experience of interacting with someone without having to have a human on the line. So here I could say something like, so this is just one scenario that we've mapped out. We have a number of scenarios around COVID-19 myths as well. So here I'm going to go ahead and agree. So it's asking me if I'm having symptoms. If I were to say no here, it's going to tell me that I don't need an exam. So I'm going to go ahead and answer yes. If I were to say yes here, it's going to tell me to go to a hospital. So I'm going to go ahead and say no. Say yes again. And now the system's determined that because of my answers, I do in fact need a test. So I'm going to give it a phone number. Now, in the background, this agent is actually going through and creating a case for me and assigning that case to someone that can then go out and call me in order to schedule an exam. You'll see that I have a case number as well. So I could come back and I could check on the status of this case at any given point. So again, this is just an example of some of the things that we're able to do with the virtual agents. While we've built a number of templated experiences, the idea here is that we would really build an experience that's specific to your organization. And then finally, we're continuing to develop functionality for this portal. So here's another example with generic branding. What we've done is we've created this portal in a way where we can kind of stick it together like Legos. So we have different pieces that we can bolt on. So if you say, I want this agent experience, but not that agent experience. I want the knowledge base, but I don't want the WHO knowledge, only the CDC knowledge. I don't want the communities. I want a different social media. We can kind of put those Legos together to very quickly build up a template and then make modifications. That's one of the reasons why we're able to deploy this so quickly, really in the span of a week or two, depending on where you're at in your ServiceNow journey. Then finally, as I said, we're continuing to introduce new features. So one of these new features that I wanted to point out is we've gone out and we've created an interface to the Johns Hopkins data and also the COVID tracking projects data. So based on that, we can now create these widgets like you see here, where we're showing the counts for states. We could show test setting for states. We could show counts for countries and for counties. This data is near real time as it can get for this type of information, updated twice daily by both organizations. Now that this data is in the system, not only can we create widgets like the one that you're seeing here, we can also create dashboards, reports, or leverage the data as part of an agent experience. All right. I think that's everything, Steve. I'm going to pass it back over to you here.
Okay, wonderful. As soon as you pass it back to me, I will share again. Okay. Can you confirm you can see my screen arrows?
Yes, I can, Steve.
Good, thank you. All right. So to summarize, and again, we appreciate your time. Thanks for being here. This crisis response portal is purposefully built, and designed around your organization. We did put some skins on this, but it's designed to get up and running really quick. And that's how we've modeled it. We've modeled the professional services side behind it as well, so that we really can hit the ground running quickly and get these things stood up. I want to emphasize again that this is a crisis response portal. It is not a COVID-19 portal. COVID-19 is one of those situations that we're modeling up here, and it's very applicable to this environment, but it is a crisis response portal, which means this is purposefully designed to have a life beyond COVID and to really help organizations manage crisis better and holistically. So some of the things that we're focused on is really improving visibility and awareness, making sure that there's good central visibility. Creating a sense of connectedness is also important. Connectedness with employees, with partners, with customers, with stakeholders, anybody who needs to have relevant information as well as stay connected to your organization. We're also focused on proactively engaging with different users while reducing the work of the service teams behind the scenes. So it's about really being able to have that central way to manage cases, to get timely information back to different users, and to reinforce that. We also want to proactively engage with users as we do that, and make sure that we're really helping to create that sense of unity and reduce any types of confusion. We want to capture important information to help you manage related work. All of that goes into this, and really the essence is creating better accountability, visibility, and transparency for the work that's getting done. So John, I'm going to turn it back to you for some Q&A moderation here.
Perfect. Hey, thanks, Steve and Eros. We do have some questions here. Maybe I'll float the first one out to you, Eros. So some folks are recognizing that ServiceNow has rolled out 4 free emergency response apps that have been out there over the last 2 to 3 weeks. And I know that we are helping clients implement those at no cost. Eros, can you share a little bit about the difference between that and the CDW designed crisis portal that we've just taken a tour of today?
Sure. So the emergency response apps are great, and we're seeing a lot of customers use them very effectively. Really, those applications are geared towards specific use cases. So you have the use case of sending out notifications where you want people to report back if they're having symptoms. You have a use case where people can self-report symptoms. You have a use case where you could see if someone who's reported symptoms may have come into contact with other people, and you can kind of manage that. And then finally, there's a use case around setting up a response team and managing the schedule of that response team. So our crisis response portal really kind of coordinates all of your efforts around a crisis response that you want to show, so that everything is in one centralized location. As part of that, we can integrate all of the functionality of those apps that ServiceNow has put out, such as the example that you saw for the self-reporting app in the demo we did today.
Well, thanks, Eros, and appreciate that. Another question we have is, will we make available not only a copy of this recording of today's session? Absolutely. We'll also send out to anyone attending today links to some other resources where you can share with other team members. Another big question is the cost side. So obviously, questions coming up here saying, you know, is this really available at no charge, and what happens after 90 days? So I think I'll share thoughts on that right away, and hopefully you'll see we've got a couple of options here. So first off, it is absolutely available at no cost today, and for the use of it for 90 days. So we'll help set this up with you. As Eros said, it will take 1 to 2 weeks in most cases to set it up. We'll help you learn how to use it, make sure you're off and running. We'll provide some orientation around it. And for 90 days, you've got use of this. And for some clients, I think 90-day use is going to bring a lot of value just on its own. And if they don't have a budget to continue after that, that's okay. They've gotten 3 months of solid use out of this. Maybe they've learned a lot about process and organizational change management, and they got some value during this very toughest time of perhaps COVID-19, if that is going to be the next 3 months. But as Eros mentioned, this goes well beyond it. To continue to manage this particular issue we're having today and other emergencies, including tornadoes, hurricanes, whatever it is that potentially impacts us, this can live beyond that. So after 3 months, there are some costs. Some of it is licensing costs. We are leveraging the CSM platform, and we can work with you separately to get an idea of what your costs will be. So with that, it brings us to closure here, and I wanted to thank everyone for joining and attending. As I mentioned, we'll send a follow-up with some additional materials, including a link to this session. And of course, you know, if you'd like to talk more about this, if you'd like to get a better handle on which parts of this might make sense for your organization, the one thing I'd suggest is, regardless of cost, even though the 3 months is at no cost, we're going to want to talk about usage. We're going to want to talk about buy-in, right? Because there is an investment you'll make in time with us to get this set up and to get it used throughout the organization. So love to talk to you more about that. Thanks again, everyone, for joining, and have a fantastic weekend. We'll get some follow-up items out to all. Thank you.